Hey guys, welcome back. So this week I am on my second week of orientation days, and today is Tuesday, so today's the second day. Yesterday I went to the diabetics team, so we went to see different patients that had to be educated on diabetes, and then I also went have orientation on my floor. Now today, I'm looking at my paper, guys. Today I am doing wound care this morning, and then I go train in ER. But this week is going pretty good. It's a lot to learn, especially like the charting system. It's a little difficult, but I'll get it down pat. And just different things like learning how the IV pumps work here versus the location that I worked actually did clinicals at. So it's just a lot of new things, but I am excited. Hey guys, I'm back. So right now I'm on lunch, and I got to take an early lunch because we finished wounds early today before I go to the ER. So I seen like venous stasis wounds. Couldn't put any compression on those wounds due to the patient having a history of DVT. I also got to see, so I didn't really get to see any drastic wounds today, but we went to see a couple of patients in ICU to do like a consult to see if they were at risk for pressure ulcers. So that was pretty cool. And now I'm going to eat my lunch. So I'm going to tell you guys what I packed for lunch today. So I packed my Ozarka water because I love natural spring water. I also packed a yogurt because I love yogurt. And I also have my turkey sandwich and some chips. Mostly on the healthy side, but I didn't really get to cook yesterday, so I just had to pack something quick. And this is my lunchbox. Bear brightly. Hey guys, so I just completed my ER orientation, which was very interesting. I'm about to tell you guys how it all went. Just getting out the car after having this mask on all day. Whew, feels so much better. But the ER was very interesting. We had a trauma situation where we had a patient that came in. He was on blood thinners and he fell out his truck. So he had lacerations in his face. He had a laceration on the bridge of his nose that had uncontrolled bleeding. His arms were very bruised and they were like paper thin. They had a lot of bleeding underneath, and he had petechiae on his chest. They were suspecting that he had 3 broken ribs while assessing him before sending him to CT due to the pain he was having and how it felt on him. He also had a history of lung cancer, so he was in sinus tachycardia, and sorry you guys, it's been rough. He was in sinus tachycardia and his respirations were shallow. And he also had a history of COPD, so that had a lot to play into things. But they got him stabilized, and then I went with another nurse, and we had a patient that was very combative. She actually ended up getting hits in the face, and it was not good. He had dementia, so it was just one of those cases, unfortunately. And that's how, you know, my ER orientation went today. Very interesting. And yeah, so tomorrow I go to cath lab and endo, so I will definitely give you updates on how that orientation rotation goes on tomorrow. So I'm so excited to give you guys a lot of information how it is to be a new nurse and the type of experiences that you may have within the second week of orientation. See you later. Please comment, like, and subscribe. Good afternoon. So today's Wednesday, hump day. So today I started off in the cath lab at 8 o'clock this morning. So I got to see one patient get multiple stents, and one of the stents was actually on a previously old stent that he had that kind of went bad. They don't think that stent is going to last anyway because of the blockage, but they just did that. And then I also got to see another patient that they went through the left radial. He had to get a stent because he had 75% blockage, so that was pretty cool, getting to see them use the catheter, inflate the balloon, deflate the balloon, and what have you. And then the last case that we had before I came to lunch was a lady. They actually was checking to see if she had blockage because she had a positive stress test. I'm back. So I kind of finished up early today because endo was busier this morning than it was this evening, but I did get to see 2 procedures on 2 different patients. I get to see the EGD as well as the colonoscopy, so it was really cool. The doctor went in and removed a biopsy sample from one patient just because, you know, she's seen something and she just wanted to check it out due to that patient's history. So, and for the other patient, she did the same thing as well. So that was pretty cool, being in the room, looking at the computer screen, seeing like when they pull the sample, because it looks really big on screen, but when you see it in person, it's actually super small. It was a very tiny sample. But yeah, so I just wanted to let you guys know about that, and I'll be back to see you. So today I went to physical therapy. We had a patient that had a stroke, so he was completely flaccid on the left side, couldn't use his lower extremity on the left hand side and his arm. So we were just trying to get him to get some movement, did a couple of exercises with the upper and lower extremities. We also had another patient that had open heart surgery, so we was trying to get her walking, preventing pneumonia, you know, keeping her out the bed. So that was pretty cool. And I also went to skills lab today with the educator at my hospital. So I am a new nurse, so there were a couple of things because of the pandemic I wasn't able to experience in clinical. So I had reached out to her and she was like, okay, I'm gonna show you, like, you know, what we do. So I got experience with using a PCA pump. So LPNs cannot use a PCA pump on their own. Like I was saying, LPNs cannot use PCA pumps on their own. The RN must be present. But if RN is present, you can actually start a PCA pump. So that was pretty cool, getting the hands on how to prime the line, where to put the syringe in the machine, and also how to program it. Also, she showed me how to use the crash cart, the pads that they use, how to use the defibrillator. That was pretty neat. And also how to set up the suctioning if a patient needs suctioning for a Perwick catheter. Also suction, you know, if it's for like an NG tube or things of that nature. And so I actually got to hook it up, turn it on, see how the pressure comes out, because if you don't do it correctly, then the suction, the things that's being suctioned will go into the wrong area, and that's really bad because that will mess up the equipment. So today and this week was a really good week. Tomorrow I'm actually going with respiratory therapy, and I also get to go to PACU to see what the nurses exactly do there and how it actually affects my unit, because I am going to be working on the med-surg unit starting Sunday night. So I'm off Saturday, and then I start my first real shift Sunday, and I'm so excited, you guys. And I hope y'all are enjoying what I'm putting out. I hope this is actually helpful to you guys. And if you like the video, please like, comment, and subscribe. Just let me know what more I can cover for you guys, what additional information I can give you. See ya.